Hi, I'm Dr. Joe Niamtu, LoveThatFace.com. Thanks so much for watching our channel, and please subscribe. I am so honored that on a daily basis I get to talk to people from all over the world. YouTube is really amazing, is social media, and you literally get to talk to people from multiple continents in one day. So if you follow our channel, you know that my passion is cosmetic facial surgery. You know that facelift is my favorite procedure. And you know that I love coming to work and working with my staff and getting to do cosmetic surgery. So today our topic is going to be how to have a good recovery and how to be a good patient. So when we think about cosmetic surgery recovery, you know, we tend to think we tend to think about the doctor. Well, is that a good doctor? Is he or she proficient? Do they do good surgery? But there's a huge other part to this equation, and that is the patient, okay? You can have the best surgeon in the world, but if you have a patient that's non-compliant, does the wrong things, doesn't follow instructions, it can really have a negative impact on what happens. So you have to say that going into this, that the success of having safe surgery with a natural outcome is to have a really good doctor and a really good patient. And I'm going to talk to you a little bit today about how to have a good recovery and how to be a really good patient. Number one, obviously you have to find the right doctor, and that's very important. And you know that there are people out there that do surgery and they don't have a lot of experience. You know there are people out there that have a ton of experience. What you're going to see is your more experienced surgeons really make it easy for you to be a good patient because they do this so much that they have everything in simplified forms or videos. So you know exactly what you're getting into. And in my office, we have videos that talk about all the procedures, that talks about the positives, the negatives, the recovery, the anesthesia, and I have very detailed videos for post-operative care. And that's why it's so important for the patient to watch these. So having said this, you know, busy practices, good practices, practices that are safe and really think this stuff out should make it easy for the patient. The patient shouldn't have to go through a lot of work to find out how to have an easy recovery. All right, so the first thing, and I think this is really the most important, and we're going to call it time. All right, time is the one thing that nobody has a lot of, and people are busy and they want to, they want to book their surgery as soon as they can. They want to have their surgery. They want to have the fastest recovery and least amount of downtime. But this is where I see a lot of people fall into a trap, all right? And let me say this, you know, some people may have cosmetic surgery once in their life. Now, we do, you know, our average age for a facelift is young enough that, you know, some people may do it several times in their life. But if you're going to have a cosmetic procedure, it's not something to rush into. And trust me, and if you talk to other experienced surgeons, they're going to tell you that their worst experiences are with patients that are in a hurry. They got to be seen. They got to get in. They got to have their surgery immediately. They can only stay 3 days. They can only miss 4 days a week. And this is just a prescription for disaster, all right? If you really want to have a safe and natural result, you have to have a relaxed recovery. It is so important. And believe me, I realize how precious time is and how hard it is to take off from work. And especially, you know, so much of our practice is out of the state or international. And I'm so honored that so many people take time off and come here. But for instance, for a facelift, I'm going to need them here at least a week, all right? And people want to, you know, they want to fly in, they want to have surgery, they want to fly out the next day. That's just too dangerous. And it's really not dangerous because what's going to happen, but you know, the whole reason that you seek expertise of a surgeon is so they and their staff can be there to tend to you. And you just can't rush it. So my primary advice to everybody is to figure this out and give yourself enough time. And sometimes it might, you know, look, I've had my eyelids done, I've had cheek implants, I've had laser, and just, you know, my own recovery, scheduling that, it probably took me 2 years to figure out a time where I could, you know, take off enough time. So just don't rush it. If you try and rush it, it's not going to be good for you. It's not going to be good for your surgeon. So that's the primary advice. So when this experience starts, generally patients will contact me or whatever surgeon. Frequently we'll look at pictures and sometimes FaceTime or Skype, and we want to get as much information as we can. There's really no substitute for a face-to-face consult, and that's what every doctor would prefer. But honestly, in many cases, there are patients that you can get enough information from the patient beforehand, and you can see them the day before and proceed with their surgical procedure. For the average patient who hopefully is not rushing, they're going to think about this, and they're going to have weeks or months to plan their surgery. So a very important thing, and it's so easy now that we have smartphones, is to make a list like upcoming surgery. And when you're driving around or you're having a cup of coffee or before you go to bed at night, and one of these questions pops into your head about your surgery or your recovery, write it down there, okay? And keep this running list. Otherwise you forget and it slips your mind, and then you say, oh my gosh, I forgot to ask. So keep a running list of what you need to do, because planning in advance is so important. Also, run through the scenario in your head. So you're going to go to the doctor's surgery center. You're going to have surgery, okay? So somebody's got to get you there. Somebody's got to get your prescriptions. Somebody's got to get you home. You're going to go to your bedroom. If that's upstairs, you want to make it easy to get up there. You want to have all your ducks in a row. You want to have all of your prescriptions, your supplies, your toiletries. You just want to really think about all this stuff and have it in place. So when you get home, all you have to do is lie on your pillow. Okay, so probably one of the top situations here where patients can muddy the waters is by going on the internet, okay, and trying to self-diagnose a situation. So a patient comes to me and I do a facelift, eyelid surgery, facial implants, laser, whatever. 24 hours later, the patient sees a bump. They go on the internet and think they have flesh-eating bacteria or something, and it's very, very frustrating. And there's some great information, obviously, on the web, but there's a ton of misinformation. And I just see so many people get themselves in a knot because they're going out there and looking at all this doom and gloom stuff. In reality, there are very few serious things that go wrong with cosmetic surgery, and do your doctor a favor and ask him or her about your situation before you do 40 hours of research on non-related things. So we're going to talk about a couple other things here, and some of these things you just may not commonly think about. So let's talk about pets, okay? So many patients have cuddly pets, our cats and our dogs and everything else, and you know, they're part of the family and we love them, and sometimes they sleep with us, but you really have to separate yourself from your pets is when you have cosmetic surgery, especially if you have open wound type surgery like lasers and etc. I mean, you think about it, your cat walks out of the litter box and jumps up on your pillow, and then you're laying down on there. And there are some well-documented studies showing that there can be significant infections from cross-contamination from pets. So you're just going to have to tell Rover that he's going to have to tough it out for a week and sleep in the other room. But seriously, that's an important situation. This next thing is a little bit off the cuff, but it's something to think about. There's a lot of evidence to show that Mycobacterium, which is not a good infection to have, lives in our shower heads. And if you ever took a good look at your shower head, you know, sometimes you can see mold and junky stuff up there. So before you have cosmetic surgery, if you have somebody that can pull off that shower head and clean it out or soak it in some of the, there's commercial preparations that dissolve the calcium and sterilize it. And you know, this is probably kind of a far out thing most people aren't going to do, but it is something to consider, because the whole time after we have this surgery where we have open wounds and open skin and suture lines, we really want to be cognizant of where we're putting our face and what we're putting on our face. So that would include, you know, bed linens, and that would include, you know, anything, the headrest of your car and our cell phones, okay? there's a lot of studies to show that one of the dirtiest things that we touch throughout the day is our cell phone. So take some Purell and clean that thing up, and that's just get in that mindset where you're going to be as clean as you can for that next week of your recovery. So we hear phrases like truth in advertising, and I have a phrase that's called truth in surgery. What do I mean by this? Well, some patients, cosmetic surgery is kind of a personal thing, and some patients maybe don't want a lot of people to know what they're doing. And so because we have an accredited surgery center, we follow the same standards as a hospital. All of our patients have to have history and physicals for larger procedures like facelifts. And, sometimes a patient will go to their primary care doctor to get surgical and anesthesia clearance, which is usually just a history and physical, and the doctor knows their patient and just says this patient is stable for surgery and anesthesia. But sometimes when the patient's going to have a facelift, a brow lift, cheek implants, chin implants, full face laser, and maybe a 3-hour surgery, they'll go to their doctor and they'll say, well, I'm having my lips done, or I'm having my lower eyelids lasered. In other words, they downplay it, okay? You got to be honest. You got to be honest with your physician, because your life could depend on it. And there's a big difference in having a 20-minute procedure with IV sedation versus a 3 or 3.5 hour procedure with general anesthesia. They're both extremely safe, but your doctor needs to know what you're doing. And we see a lot of people sugarcoat that. The other problem that we see are people that really aren't truthful with their spouses or their caregivers. Now, most frequently a caregiver is a husband or a wife. And I could tell you some funny stories where somebody comes in for upper lids, lower lids, facelift, full face laser, and they told their husband that they were just having their lips injected or something like that. And we've seen a couple battles in the recovery room. Again, it really does help to have everybody informed of what is happening. And I realize there are some cases where maybe that could be touchy, but the more straightforward things are, the more straightforward your recovery is. So a couple more things here. I know we're running in a lengthy video, but I think this is important stuff. So again, in tune with the planning in advance, you don't want to get home and you're groggy from your anesthesia and you're taking pain medicines, and then you have to try and figure out what you're going to eat that night. So post-surgical nutrition is important. You don't want to eat things where you have to open your mouth real wide, where you have to chew real hard. You really want liquids and soft foods for those first couple days. You want protein for sure. That's important for recovery and healing. So it's so easy in this day and age to get protein drinks. And you want to stay hydrated, so having Gatorade or similar energy drinks like that replete or that replace your electrolytes are very important. You can't have enough of that because you want to stay hydrated, you want to stay nourished, and you want to have protein. Okay, here is a biggie. So many people go to the gym and work out, right? And it's an important thing, and physical fitness has always been extremely important to me. So I am very well aware of the addiction. And probably the most common question I get about recovery is, hey doc, when can I work out? All right? So again, people that work out and go to the gym all the time, they hate to miss a workout. But actually, taking a week or two off is really good for your body. It allows your joints and your tendons and ligaments to relax and heal, but it's very hard for some people to do. So for most procedures, the two things you don't want to do, number one is increase your blood pressure. So anything that you do, whether it's coughing, sneezing, vomiting, grunting, bearing down, bending over, picking things up, that sends blood to your head. And like for facelift surgery or eyelid surgery, bad things can happen, especially with eyelid surgery. So, you got to have 4 or 5 days where you're just taking it easy. And if you can't do that, really, you shouldn't have cosmetic surgery. So when can you start working out? Well, here's what I tell my patients. So for eyelid surgery, if they take a week off, start back at 50%, and by 2 weeks, they can go to 100%. For your bigger procedures like facelift, and that's, I do 3 facelifts a week. We do about 100 a year. So that's a big procedure. And what I tell people is at 2 weeks, they can start light cardio. Now they can go out and walk around the neighborhood. They can get on a treadmill or a stationary bike, and they can do cardio at 50% of what they normally do. I don't want them at a 2-week period to be doing resistance exercises where they're, bending and pushing. So they can start that, I'd say at about 50% at around the 3rd week. For facelifts, the worst thing you can do is things that are going to be stretching and pulling at these stitches. And so, that would be things like tennis or yoga or anything, golf, anything, so many sports, all right? You got to wait a month, all right? Most doctors will tell you wait 4 to 6 weeks, but the type of facelift I do, and I use a lot of sutures and I don't take any shortcuts and everything is tight there. I think in a month, people can return to their normal workout regimen, but talk to your doctor and listen to what they say. So I'm also going to show you some kind of humorous diagrams that detail the recovery experience, which for a lot of people can be kind of like a roller coaster. And I may do it in this video, or I may make it a separate video. So regardless, just to summarize this, if you're going to have surgery, do yourself the honor of having a relaxed recovery. It will help you, it will help your surgeon. If you're going to the right place, they're going to have all the instructions very easy for you to follow, but you have to read them and you have to follow them. And remember, a lot of times right after surgery, people feel good and they get out and they do too much, and then that sets the clock back and it complicates their recovery. So good surgery result equals informed and a relaxed recovery. So very important thing here. Sometimes you just can't rush things, okay? I mean, it takes a while for the caterpillar to turn into the butterfly. And if you had talked to any cosmetic surgeon in the world and said, what would be your first request? They'd say, take the patient's mirrors out of their house for the first month after surgery, okay? That's kind of tongue in cheek, but here's the situation. It is very frustrating for a surgeon when a patient comes in 2 days after surgery and starts complaining about the result. Okay, I mean, you've got to give this time. It takes time for this, and I'm going to show you in a separate video this roller coaster of healing. It takes 3 or 4 days for the swelling to get where it's going to be, and then it takes 3 or 4 days to start going down. And we don't take our final pictures for 90 days because I think you have changes that go on for about 3 months. And although most people go back to work at 10 days, 2 weeks, depending on the procedure, it really takes a while for everything to settle in. So you really put a lot of pressure on your surgeon, and technically you're being very unreasonable when you start to worry about the result immediately after surgery. You got to give it time to settle down, with very, very rare exceptions. But it's okay to talk to your surgeon. But some people come in and they say, gosh, I'm swollen over here. Well, yeah, you had surgery yesterday. And from time to time, patients aren't going to be satisfied with their cosmetic result. And most surgeons will bend over backwards to make sure that the patient is satisfied. If you have a reasonable patient and a reasonable surgeon, usually things work out very well. You do see patients that want a second opinion, and there's nothing wrong with that. However, I really think to be courteous that you should give your primary surgeon the ability to examine you and answer your questions and offer treatment options before going to another doctor. I just think that that's a good thing to do, and not only is it courteous to the doctor, but you need to keep those communication pathways open. And if you have a problem and you don't let your surgeon know and you go somewhere else, that can just be very frustrating. So it's very important to remember that your surgical result can take months to achieve that final state. I don't even take my after pictures for 90 days because people go through changes, and sometimes there are even changes after that. And part of the whole thing here is to relax and be patient. And it's very frustrating for a surgeon and their staff when a patient's, 1 week out of a procedure and they're complaining about their result or worrying about bruising or swelling or asymmetry, because 99% of the time it all gets better. Now, there's another component to this, and that is revision surgery. So I've done 1,300 facelifts. We do about almost 100 a year. And I consider myself very conscientious and good at what I do, but I don't care how good you are. Every surgeon is going to have some type of situation that needs a revision, all right? Because when a patient's asleep and they're laying down and their incisions are open, you have to use your best clinical judgment and artistic capabilities to determine how tight to pull it, in which direction, and everything to have a natural outcome. And every once in a while, the patient needs a little touch-up. They need a little tuck or a little lipo or a little skin pulled or something like that. So the best time to discuss this is before your surgery, okay? And you want to find out what policy is in your surgeon's office. For instance, in the first year after surgery, we don't have a surgical fee to do revisions on our own cases because that's just part of the situation. But not everybody's like that. I have patients that come here for me to do a revision because their original doctor wanted to charge them the entire price of their original surgical procedure. So like anything else, any other contract, anything else you do in life, find out these little things up front. And I think these are some of the most important situations that deal with having a safe recovery, an easy recovery, and how to be a good patient. I'm Dr. Joe Niamtu, LoveThatFace.com.